Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guest on the program today is Dr. Scott Samera. We're going to be talking about podiatry, everything you wanted to know about your feet, but we're afraid to ask. We'll talk with him when we come back. Don't go away.
Being a registered nurse is a rewarding job. But if your career goals have you looking for more, Florida Gateway College can show you the way.
As a nurse, I love to help people, but I wanted to go further.
With our Bachelor of Science nursing degree, RNs have the opportunity to increase their career options and income earning potential.
Now I've got more choices, and the extra money isn't bad.
Start your journey today at Florida Gateway College.
Welcome back to Perspective on Florida Gateway College. Dr. Scott Samera is a podiatrist in Lake City and in Brantford, and we welcome you to the program.
Thank you, sir. Appreciate it.
Now, I wanted to ask you, you grew up here in the area and you came back to Lake City. You were telling me you played soccer at Columbia High School back
Sure
in the
did.
day.
Way back when.
Way back when.
And that's actually what got me interested in podiatry, is that I was a soccer player back in the day and I was a skateboarder, so I always had problems with my feet. So I had to take care of my own feet before I could take care of other people's feet.
So talk about that. A lot of people, they don't think about their feet until there's something wrong.
Exactly.
We were talking to Janice Watson before the program, and she says it's really true that you take your feet for granted until you're having struggles. And so talk about podiatry in general. What are some issues that can occur with your feet?
Well, there's the obvious, if you have ankle sprains and ankle fractures and foot fractures and things like that. But the thing that really gets people in the office is they have a problem with ingrown toenails, which happens at pretty much any age. Fungal toenails is a concern because there's people that are vain, but then again, fungal toenails can cause a lot of pain too. Heel pain is probably the number one thing that people deal with their feet. And with that being the biggest problem, that brings people in the office pretty regularly.
All right, let's talk about the first thing, and I think most people have had ingrown toenails. What causes it? I mean, because all of a sudden, one day you just get a little problem on your big toe, or it could be any toe, right?
Right, yes, sir. You know, when you look at ingrown toenails, the first thing you want to look at is the kind of shoes people wear. People don't wear the right shoes. So if half the people wear the right shoes, you wouldn't come see me too often. But you know, it's common with children because children, they're running around kicking things, getting their feet stepped on. In Florida, a lot of people develop fungal toenails, so those get thickened and enlarged, and when that starts to put pressure on the toe caused by shoe gear, then that becomes a problem as well.
Does Americans don't know how to buy shoes? Because it sounds like, is there a right way to look for shoes?
There's definitely a right way to look at shoes. You know, the way things are nowadays, you could go into many shoe stores and you got to self-service yourself and try to figure out what shoe is going to work best for you. But there's not a lot of places where you could find shoes or shoe salesmen that are going to measure your feet. So there are a lot of problems with shoe gear nowadays, besides the obvious with females wearing heels that are about this tall, which I don't have a problem with. But, you know, that causes a lot of problems.
So you should go to a better shoe store, because sometimes if you see something that looks nice, you're willing to buy that. I think everybody does that. Even if it's a little tight. Right. Is that what you see a lot?
Well, a lot of tight. You know, for the young people, a lot of young people like to wear the skateboard shoes where they don't tie their laces and things like that. It's very fashionable to go back and wear the retro type sneakers where they have no arch support at all. It's a lot of it has to do with fashion. You know, even the shoes that are so-called comfortable, when you go to the name brand shoes like the Dr. Scholl's, which Dr. Scholl's is a podiatrist and he does have a name connected to a product, but that's a lot of marketing. That's good with it, but you know, even Nikes, which I'm sure plenty of people see me going, well, I saw Dr. Samera wearing Nikes, but he's talking about not wearing them all the time. Very popular shoe, but not always the best shoe for comfort. There are certain brands that that podiatrists stamp their names, which are more comfortable for people. But I don't care if you get your shoe at Walmart or Payless or the most expensive shoe store. You got to look at your foot and then look at that shoe and say, my foot's gonna fit in that shoe very comfortably. That's probably the number one thing.
Now, well, let's talk about, you mentioned arch support, and
Yes,
that's
sir. Mm-hmm.
the arch on your foot.
Instep of your foot, yes, sir. Mm-hmm.
That has to be supported,
Right.
and the shoe needs to go up to support that,
Yes,
correct?
sir. Yes, sir. I mean, there are people that are very flat-footed, so they don't really need supportive shoes that way. But for the majority of people, arch support is very important in addition to the correct size.
Now, if you don't have the proper arch support, does that cause problems further down the line?
It does, and the thing about it is you don't notice it right away. There's a very popular kind of shoe that's out right now, and it's those pillow top types of shoes that, I hate mentioning brands, so I'm going to stop doing that.
Okay.
But when you step in that shoe, it's almost like that mattress where you sleep, and great, that's comfortable. But when I talk about arch support, if your foot sinks to the bottom, then you might as well just walk around barefoot because it's not doing anything for you. And I know when that shoe came up and I saw that first commercial, I said, that's going to bring a few patients to my office.
Good for you, but bad for the folks out there. Let's talk about. Is there a time when you're buying shoes that you should walk around in them in the
Yes.
store?
Yes, sir.
And not just, walk there and back and then buy them?
No, you should definitely try your shoes on, and you want to aim towards the end of the day because that's when your feet are more swollen. That's when you've done the majority of your standing and your walking. So the end of the day is usually the most ideal time to do it, and definitely put them on and walk around. I advise everybody, when they get the shoes, kids or most people, they want to put them on and just walk around with them because they think that's comfortable and everything else. But bring them home, wear them around the house for a little bit and say, these are the shoes that I want. Don't sit there and put them on and walk out of the store and think that's going to be the best shoe for you, because I've seen a lot of problems even with diabetic shoes, which are prescribed shoes. That's what's recommended is that you take the shoes, you bring them home, you wear them around the house for 30, 45 minutes, check your feet, make sure that it's not causing any rubbing, any wounds, or even any ingrown toenails, things like that.
Now, you also deal with, I was telling before the show that this is kind of the forgotten part of the body, or the body
Definitely.
part that gets forgotten until something goes wrong with it. But what are typical problems? It's complicated. The foot is complicated. There are a lot of bones in the foot that you have to
Most
deal
bones
with.
in the body, 26 bones in the foot.
And
a lot of
there's
tendons and
problems that
ligaments.
can happen with any of those. If someone presents to you with foot pain and they're maybe in their 30s, are you looking at every bone to see, or what are you doing when you diagnose?
Well, first things first, you want to sit here and say, if you could take your one finger and tell me exactly where it's hurting, point to it. That will help out quite a bit. That's the good thing about podiatry as opposed to being a veterinarian. Veterinarian, your patients can't talk to you. So,
Right.
You got to be able to talk to your patient, and your patient describe to you exactly what's going on, what happened. Did you fall? Did you trip? Somebody step on your toe? Or your foot? You got to ask the questions. It's kind of a collaborative effort, because that first time in the office, the great thing about podiatry, I could give you an injection, I could put a wrap on, I could tell you need to get into better shoes, and you could walk away comfortably, as opposed to other doctors where they're putting something in your mouth or something causing pain. No offense to my dentist friends out there. But the thing about it is, with the foot, when I say it's a collaborative effort, I might sit here and say, well, let's try this, all right? And then come back to me and see me in a couple weeks or a month, and let's see if we figured out what the problem is. It's diagnostic, whether it's putting a wrap on, putting some arch supports in your shoes, giving an injection. And if it's still lingering, then we need to go to plan B.
Now, there can be a tendon problem as well.
Sure.
You could have walked on it wrong. You could have walked across an incline, or you could have done something, and all of a sudden you've got this problem.
Right.
And it could get worse over time,
Sure.
and then they go see you and say, what's going on?
Well, God forbid an ankle rupture or ankle tear is terrible. You never want to do that because it takes a lot of time for that to heal. But we see that a lot in the weekend warriors, my buddies going out there and say, hey, Scott, let's go kick the ball around. Let's warm up and do the proper things we do so we're not going out there and rupturing our Achilles and things like that. But Achilles tendinitis, plantar fasciitis are very common foot problems.
What causes that? Is that just wear and tear, or is that where you go out and you do, I was talking to somebody the other day that likes to play rugby on the weekends.
Okay.
Of all things to play, that's probably the most physical sport you can.
And one of the most physical sports, definitely. The plantar fasciitis and the Achilles tendinitis, it's an inflammation of the tendons. And the way that it gets inflamed is it could be from some overuse, from strengthening of the tendons there, but the tightness that occurs is what really causes the problem. It's the pulling of the tendon against the bone. So a lot of stretching exercises are out there to alleviate this. Icing definitely would help alleviate this. Like I tell all my patients when they can't figure things out, if you wear the proper shoes and you did a lot of stretching like I tell you to do, you really wouldn't have to see me. For the majority of patients, that's relatively true.
Do you see a lot of young people in your practice? I know that sports injuries, in soccer and in football and things like that. Do you see a lot of kids that way?
I do see quite a few kids. In this area, we're in Florida, so, there's a lot of geriatrics. But with kids here, I see them usually for the same kinds of problems, which is ingrown toenails. Not so much sprains, but, kids are so active nowadays, and it's a different era with sports and activity. I see a lot of overuse nowadays compared to, even when I started practice in Lake City 4 years ago. You wouldn't see the kids coming in saying, well, I'm having a lot of pain here. There's this calcaneal fasciitis, which is basically a growth injury that happens with a lot of growth spurt, as well as tightness in your calf muscles. But you see it more common now, and then you ask the mother or the father or even the child, well, what are you doing? Well, I got cheerleading practice, from this time to this time, and then I go off and I play soccer, and then, I want to play on the weekends too, and I'm like, oh, that's a bit much, and it leads to these types of injuries. But ingrown toenails by far is the number one thing I see in children. Every once in a while there's a sprain, but it's harder to sprain in your ankle or your foot when you're a child.
I know you mentioned that ankle problems
Yes, sir.
take a long time to heal. Is that typical because you don't? People want to continue to walk on it.
Yes, exactly.
So is that how that works?
And as my history as a soccer player and a skateboarder, I'm guilty of it myself, and it still lingers to this day. But when you sprain your ankle, what happens is you have all these ligaments that are around the bone structure, your ankle joint. And when that gets injured, it inflames, okay? And when it inflames, the tendons get pulled apart, all right? So what do they tell you to do? Rest, okay? There's a mnemonic out there, it's RICE. You want to rest it, you want to ice it, you want to put some compression, which is like an ACE bandage or an ankle brace, and you want to elevate it. Who does that?
Yeah.
Especially when you're young and you're like, well, it's going to keep me off the field, but it's going to be better for you in the long run because it's going to help heal it. Because if you let these ligaments stay extended like this, and the swelling is going to go down eventually, if it takes a while for it to go down, then everything's stretched out, okay? And so you're more prone to those chronic ankle sprains, which nobody really wants.
The last possible resort for a lot of injuries is surgery, but you do surgery
Yes, sir, I do.
What is the most typical surgery that you perform in your practice?
Typical surgeries, unfortunately, in this day and age, with the diabetic population, is amputations or incision and drainages. Elective surgeries, they're still out there. We do a lot of bunions and hammer toes, soft tissue removals, but unfortunately, in Florida, you see a lot of diabetics, and we're in a rural area where healthcare isn't as populous, so instead of going out and seeking something, they kind of want to treat it on their own. And by the time they do see me, unfortunately, I'm seeing them in the hospital, and it's too far along. And that's when you see those people that have lost their toes or half their foot or even below knee amputations, which is unfortunate.
Now, I know that a lot of people like to do the home remedies. My grandma used to do this, and at what point should they actually come see you? Is it when something won't heal on your foot?
Well, every problem with the foot or ankle or any part of your body, there's a time and a place for it. Obviously, if you're bleeding excessively or if you have a wound, you need to come see me. If it's a small little scrape or something that you might be able to handle, then Neosporin and Band-Aid and keeping it clean should help. But if you're a diabetic and you run into this problem, it's a completely different story, because that little scratch on a diabetic can become an infection, it can become cellulitis, can become a trip to the hospital and antibiotic therapy very quickly. Ingrown toenails, I always tell patients that's another common injury, is that you want to just soak your feet in some warm water and Epsom salts to start off with, and just see if you could get that nail to kind of alleviate itself that way. But when you start to see it get red and inflamed and starts to give you a lot of pain, come see me. Obviously, if you have pain where it's a 6 or 7 out of 10 for a few days there, come see me.
Well, and you don't want people doing surgery on their foot. I mean, themselves. 'Cause, I mean, I'm sure you've seen that.
Yes, plenty, especially with the ingrown toenails.
Yeah, well, I can do it. And then you get into it, and it's next thing you know, you're in your office, right?
They are, and I talk about the kids a lot, but I had one gentleman that come into my office, and he was in construction, and he was on the roof a lot, and pretty much every single one of his toenails was ingrown, and I'm sitting here going, oh my gosh, when did you decide that this
Well, that's
was
got to be painful
problem?
to have every one of your toes have an ingrown toenail.
Exactly. That's what I'm looking at going, that had to hurt sooner or later. So fortunately they came in, and there are procedures we can do to help alleviate it. It does take a few days or even a couple weeks for the post-procedure care to take care of those things, but those nails need to be coming out, because besides what's causing the problem in the first place, and making sure that we get the right antibiotic to your body there is going to help alleviate that problem.
Well, and I'm sure this guy never had a pedicure, but do you recommend that people get a pedicure occasionally, especially if they've got a history of having bad toenails?
Well, as diabetics, you really should refrain from going there. And the thing with diabetics is they have neuropathy. You have an issue where you don't feel anything. And if that becomes a problem and you go into a salon, if you don't tell them, they're not really going to know. So they're going to be doing this, that, and the other. And next thing you know, they'll cut into you, and you're not going to notice it right away. And you're going to think, well, this looks pretty. And then when you take off your shoe, you're going to go, wow, I got a little bit of an infection there. I get it, that is a common question as far as the salons and everything else. I don't really have a problem with it, because obviously they provide a good service out there, but there's a time and place for everything.
Well, and you know what you're doing when
Yes,
it
sir.
comes to those folks that have problems with their toes.
Yes, sir.
And so you know the right way to do it to overcome any issues that may occur because of cutting it down to the cuticle or things like that.
Right. I mean, and that's the thing about it. That's why, because there's so many salons out there. There's so many workers that work in the salons, and I always ask, well, which salon do you think's best? Which salon do you think's the cleanest? This one looks clean. This one looks clean. I know this place sterilizes their equipment, but is that person that's in there that day going to sterilize it? And that's the thing about it, because I have so many patients that go to the salons, and they'll talk to me and they'll say, well, I've been going there for years, and then I had this one person and they went a little bit too deep, and that's why I'm here to you today. Now I want to switch to another place. Where do you think I should go? And that's what I try to tell them. It's at your discretion when you go into these places. Like I said, they do provide a service, and they do provide a good service for a lot of people. But you kind of have to use common sense when you're looking.
Well,
at
and I think I would stack your training versus somebody else's training in a nail salon. I want to go back to the diabetic. Well, I tell you what, we'll do diabetes, and then we'll do elderly.
Sure.
Because there's two different types. The elderly have different issues than diabetics, or there may be a combination of those issues.
There's definitely an overlap there.
Let's talk about diabetes. What is the cause of foot problems with diabetes? Is it the blood flow is not getting to where it needs to go?
Well, with diabetics, you have a compromise to your health there. So your body isn't going to run as regularly as somebody that doesn't have diabetes. When you have some sort of injury, it's not going to heal easily. When your blood sugar is high, or you're going to have some problems with your circulation. You're going to have some problems there with your nerves, and the health isn't what it would be in a completely healthy individual. So you run into problems where, one, you're not healing as properly or as easily. Two, you're developing the neuropathy where you're not feeling anything, which could cause a lot of problems. But then a lot of diabetics are on a lot of medications. With a lot of medications, it could produce swelling in your body. That adds to a problem too. And that's why we need to look at the feet, because there's this diabetic shoe program that's been around for years, and government pays for it. Well, most insurances pay for it, depending on how things are nowadays. But the thing that makes a diabetic shoe different than a regular shoe is the way that it's stitched on the inside. They stitch it in a way where it's more seamless than not. So you can imagine if you're diabetic and you don't have any feeling and your feet are swollen, you put on a shoe that has laces pointing out this way and grommets that are going to stick into your skin, that could cause a wound, that could cause an injury, and that could be problematic. As opposed to a diabetic shoe, which a lot of them are going to be light, they're going to be very comfortable. Obviously they're going to be fitted properly. At a doctor's office, we actually cast our patients where they could get a custom molded insert for their foot, because these diabetics that kind of missed the boat, that or unfortunately something happened, they develop an amputation, or they have an amputation, or they develop wounds on the bottom of their foot. These custom made inserts will cause offloading or help offload those areas of the foot. They'll also accommodate for those areas where you've unfortunately lost a part of your foot there. So that's out there for these people. But with diabetics, let's be honest, a lot of them don't take care of themselves as well as they should, and it's difficult, especially in the younger diabetics that are out there. The younger diabetics, when they come into my office, around my age or even younger, I express to them that I feel for them, because you're in a different category now. You have diabetes, and you have to know that more than likely diabetes is going to contribute to taking your life one day. But it doesn't have to be in the next 10 years. It could be when you're 90 or 100. I see plenty of diabetics that they take care of themselves, and that's what they deal with. Unfortunately, when you're younger, and you see your peers eating a cake or even drinking a beer, and you want to say, well, why do I have to be different? Because your body's different now. So I always have a lot of the primary care doctors, we have a good relationship where when somebody's diagnosed with diabetes, they're sent to my office, and I run over all these other things with them. They might not need that immediate diabetic foot care, or might not be interested in diabetic shoes at this point because they have good sensation, and a lot of the diabetic shoes aren't as fashionable as what younger people want to wear. But it's important to kind of drive home what needs to be done and what needs to be concentrated on.
I want to talk about the dreaded G word now, gangrene.
Yeah.
Now, that is, what causes gangrene? Is it a diabetic problem, or I think I've heard soldiers during World War II used to get gangrene because of having wet feet all the time. So what can cause it?
There's different reasons for causing gangrene. When you talk about soldiers, you're thinking about those soldiers that were marching in snow and they get frostbite, and that develops in the gangrene. But the majority of patients that have gangrene in a normal setting like this is those patients that have poor circulation. So what produces poor circulation? Cigarettes. Cigarettes are probably the worst thing that's out there for everybody, and it hurts my feelings when I see it in this day and age, because back in the 60s and 70s, when it was cool to smoke cigarettes, they didn't know, but there's so many warnings, and they do a good job of putting these commercials are out there where they see patients saying, well, I lost a limb because of this cigarette smoke. And I have friends that smoke, and I'm telling them, like, listen, this is for real. It's not they're not putting this out there as a little bit of a scare tactic, because this happens once in a while. This happens very prevalently, very prevalent out there. And I show them pictures. I said, well, this is gangrene. And what did you do? I said, well, I had to amputate it, obviously.
Is that the only cure?
No, that's not the cure, but a lot of those lead to that. Okay.
Well, and I think what you're probably trying to say is that a lot of people let it go to the point where you can't do anything else, right?
Well, that's true, but at the same time, when your blood vessels start to close up, where you're losing that circulation in your body, it doesn't, sometimes it's gradual in a lot of people, but sometimes it just happens one day. And you're looking at your foot, and it's starting to get a little bit dark. Or I have that patient that comes in and says, last week my toes were a little bit dark and discolored, a little bit dusky in appearance, but now they're completely black. What's going on? I'm like, well, all that circulation that was going to your toe last week, or the remaining of it, has shut down right now. So we need to do a referral to there. Luckily, we have procedures nowadays where we could open up the blood flow to these areas if we catch it quickly. But there are, just like anything else, as we talked about earlier, there are times when you wait a little bit too long. But when you have these kinds of things, if you have a history of smoking, and of course this comes up, well, doc, I haven't smoked for 30 years. I'm like, yeah, but the damage was already done. So if you start feeling some pain and discomfort in your toes for no reason whatsoever, you need to get that checked out, because let's think about where your toes are. It's the farthest place away from your
Yeah, I
heart.
was just going to ask you. That's the heart has that's the longest distance
Right,
to
exactly.
get there, and when you do something that's going to kind of stop that or hinder it,
and then we can
makes
lead
things
into some
worse.
problems. Yes, sir, like gangrene.
You do surgery. You also do therapy when they finish with surgery, or if there's a therapy that has to happen because someone has done something to their ankle.
Well, you know what?
Recommend therapies.
I recommend therapies. I definitely like to educate my patients. That's one good thing about my practice and podiatry in general. It's an education process. Okay, with therapy, I like to teach patients or show patients ways to alleviate a lot of the pains and discomforts that we have. But at the same time, there's plenty of physical therapists that have modalities that are going to be beneficial to patients. So a lot of that I refer out, but if there's a way that I could help a patient in my office, I'm going to do my best to do so. Okay, because that's one of the common things with patients is, you know, when you have to go to physical therapy, well, doc, that's going to take some time out of my life. Well, let me show you some of these stretches. And it's important that we take 5, 10, 15 minutes to go over some of these things that are going to help alleviate, whether it's strapping or wrapping your ankle a certain way or doing certain types of stretching exercises. But, you know, if we go and you come back and see me and we have to go to that plan B, you're definitely getting that referral to a physical therapist.
I guess if there's something you can take away is comfortable shoes that are beneficial to you walking, because the last thing you want to do is end up in a wheelchair because you can't walk, especially in your later years. Yes. If you'd like any more information about Dr. Scott Samera's practice, his office in Brantford is 303 Swanee Avenue, 935-1093 is the contact information down there, and I'm sure someone on his staff can answer any questions if we haven't answered your questions on the program today. Dr. Samera, thanks for being on the program.
Thank you. Thank you for the opportunity to talk to you. I'm glad to be back in the community that I grew up in. You know, I've stayed in this area pretty much the whole time of my schooling, but I did go to New York City, and I came back to Tampa to come back home to take care of the people that I know and love. So it's a community that I grew up in, and I'm glad to be back, and I'm glad to help serve people here.
Go Tigers. Dr. Scott Samera, podiatrist here in Lake City and Columbia County. Thank you for being on the program, and thank you for watching Perspective here on Florida Gateway College Television. Until next time, I'm Mike McKee. So long.